their interests. A lot of research about them, for them, and so on, but they never get to hear about it. Or if they get to hear about it, it's in a language they cannot access, it's in a format they cannot access, it's on a platform they don't have access to, and so on. So they might as well be blind in this whole equation. So those are the three major partners. Our imperative, I'll talk a little bit about myself. I've been in academia. This year makes 30 years since I joined academia. I joined in 1994. I hope my mathematics is correct. So this year I make 30 years. And I've done research, of course. I've published, of course. But a lot of times it felt like I was on a treadmill, just going, because you publish every year, you must publish something, publish or perish, you need it to be promoted and so on and so forth. But it wasn't necessarily linked to what is this for? What problem am I trying to address? What issue am I trying to address? Even if I'm addressing theory, so that what? I think that aspect has been absent for the bigger part of my academic life, and I suspect that I'm not alone. It's only in recent years, and by recent years, I mean maybe the last 5 years or so, that I have become very intentional about I need to be looking at real problems so that my research contributes to real problems. And that takes a lot of relearning. It takes a lot of getting into the right networks, working with other people instead of working alone, getting onto projects so that you can get expertise from different disciplines, because you can't do everything. For example, I'm very interested in health, but I'm not a health person. I don't have any health training. But if you're on a project where there are social scientists, there are biological scientists, and so on and so forth, you can come out with a product that then can serve the purpose or address the question. So the point I'm making is that there is so much that is wrong in our midst that we cannot ignore uptake and impact and just be satisfied to be star academicians. 20 publications, 30 publications, 50 publications, this kind of ranking, Google knows you, etc., etc. I think there's too much going on that needs us actually intervene and make a difference for us to ignore uptake and impact. We need to worry about the last mile. What happens to this evidence that we generate and accumulate in journals and books and so on, and conference halls? So ensuring uptake should be, for me at my age, ensuring uptake should be a matter of urgency. And I think I said this when we had a get together a while ago with some members of NEMRA. So what is research uptake? There are, of course, different attempts at defining research, but it is defined as the utilization of research findings by researchers, policymakers, implementers, or practitioners to inform policy or practice. I want us to note the word inform and keep that word because I'll come back to it, and also to note policy or practice. A lot of times we are focused on policy, but sometimes evidence from research needs to inform practice, sometimes even directly. So research uptake involves the practical application of research knowledge to address real-world problems. And it encompasses all activities that contribute to the use of research evidence by various stakeholders, including policymakers, practitioners, and development actors. It aims to bridge the gap between research and action. I will, of course, at some point talk about communication, and you will understand why, but research uptake involves effectively, and I want to add strategically, communicating and integrating research findings into different fields. This is where people like Rugendo come in. You also will have to pay me for this commercial. It involves seeing, it involves talking, and it involves listening. What do I mean by this? You must Research should be about a problem we have identified, an issue we have actually identified by seeing. It should involve us talking so that we are not working alone, but we are actually talking to all affected people so that when we eventually produce evidence, it has got the rich input from the various people at different levels vertically, but even horizontally in terms of disciplines. It also involves listening, and this is where the about our research agenda, that we forget who we are doing this research for, and we leave them out. So effective communication ensures that research knowledge is disseminated and utilized to inform decision-making, but also to improve outcomes. So why are we having this conversation about multimedia? I think the purpose is to enable us to pay attention to the importance of effective communication and the role of multimedia in bridging the gap between research and its practical application. And why does research uptake matter? There is a fair amount of research indicating that a significant proportion of resources invested in research worldwide is not recovered. It's just lost. I will give you an example. I was at Makerere, I was on a number of projects. And a lot of times, if you really took that budget and broke it down, a lot of the money went into per diem. Simply per diem. There is nothing wrong with per diem. We need it. It helps our families to survive, etc. But if I was a funder, and now they have woken up, by the way, they have become very strict. If I was a funder and I looked and 70% of my budget is going into per diem, I would know there is a problem here. So, but also sometimes the money goes into the actual implementation of the research activities, but the results, the evidence just sit on a shelf. They are not used for anything. So that money is wasted. The person who is involved is not consulted, so that sometimes what you give to them is irrelevant and that is wasted and so on. This highlights the issue of inadequate research uptake. In East Africa, I found out that Kenya invests the most on research, but they still invest less than 1% of their GDP. Uganda is, I think, 0.4 something. Some countries are 0.3 something, and so on. The average globally is 2.1%. Research aims to contribute to theory. It aims to inform policy or to influence practice. It does other things as well. But when research findings are not utilized, its purpose is defeated, leading to a loss of potential benefits. To speak specifically about countries who ascended to the middle income, I understand, but low and middle income countries, the lack of research uptake is particularly concerning in these countries where resources are limited, problems are numerous, and maximizing the return on research investment is crucial. While researchers often share their findings with peers through publications and presentations, it is essential to engage policymakers, communities, and the general public for research to have a broader impact. I'm struggling to find which view. Maybe I should have let some genius run this. Struggling which view to use so that it doesn't interfere. Okay. So there are a number of barriers to research uptake. And here I've just used the three categorizations: knowledge barriers, attitude barriers, structural barriers, but this is not the only way to categorize them. I've seen environmental ones and a lot of others, but this captures the essence. So in terms of knowledge barriers, there is a wide lack of awareness and limited access to evidence. And like I said, the evidence lives in one room. The people it concerns live in another. and they sometimes don't talk at all. And sometimes the reason they don't talk is because the people who need it the most cannot access it. Either the language is wrong, the forum is wrong, and so on. I was involved one time in disseminating the results of policy, communication policy, and we were making up the invitation list. And some of the considerations that go into the invitation list would break your heart. It's not who needs this the most, so what efforts can we make to reach them? But first of all, who will not ask too many questions and set us back? Who can afford to come? Who is our partner so that we are scratching each other's back, and so on. And when we come to the discussion, please correct me if I'm wrong on this. As a result, we talk to ourselves and we say we have disseminated, that's it, uptake should be automatic. We also have challenges in understanding research findings. I've talked about this. There is also a lot of misinformation and disinformation. Wherever there is research, there is a counter voice saying that research is wrong, no, the evidence was not properly gathered, and so on and so forth. There's misinformation and there's disinformation, and these are knowledge barriers. There are also barriers of attitude, like a perceived lack of usefulness. The idea that research is for up there, it doesn't concern us. It will not change anything. Ordinary life is not really changed by research. There's a lack of motivation for uptake. These days you go to a village and you have a project, maybe you're trying to improve livelihoods or something, and people want you to pay them for attending the seminars, to enlighten them, or you're wasting their time. But it's about them, it's for their sake. But understandings of motivations are different. Sometimes, there just isn't the motivation. There's also lack of trust in the research findings or sometimes in the sources. There are people who have decided that if research is by Ministry of Health, it must be falsified. We don't trust it. Or if it is not by Ministry of Health, we don't trust it. Or if it is by this donor, not that donor, funded by, we don't trust it. These attitudes can stem from skepticism, they can stem from lack of understanding, they can stem from community, policymaker, or researcher arrogance, just plain arrogance. One of them just deciding they will not learn from this, they are not interested, they will not change. Then we have structural barriers. These are usually beyond one zone scope, like financial constraints, like inadequate policy frameworks. You may have very good evidence, but the frameworks do not allow for a change in policy at this time, even though it's needed. It will take another 3 years because our policy says we review it every 3 years, and so on. And that's a very simple example. Then insufficient training of practitioners, the people who will implement the changes that research seeks to effect. Then limited access to products or services is a very big one, especially in the health sector, because if you tell people that this vaccine is not working, it is the other one that works. You want them to move to the other vaccine, but if you don't provide it, how do you expect them to move to it? I have found out that these days, most hospitals do not have reagents for COVID-19 because they believe that COVID-19 has ended. Actually, there are cases of COVID-19. I tested positive for COVID myself a week ago. But for me to be able to test positive, I had to ask the people, do you have the kit? They said, no, we don't, we no longer. I said, can you get it somewhere? They thought and eventually said, yes, they can buy it somewhere and test it. And they brought it, tested, and I was positive. The symptoms were all there and all. But lack of access to products or services, family planning services, vaccine services, any other services. Then another structural barrier is the way we are structured to work in silos. I think NEMRA is a wonderful network because it allows us to break out of our silos, our disciplinary silos, our university silos, and so on and so forth. So the whole structuring so that every university works alone, every department within the same university works alone and so on, this is a barrier. Then of course there are failures in engagement that I'll talk about a little later. I also looked at challenges that were peculiar to East Africa since this was our scope. And there may be some overlap, but I'll share them anyway. A lack of understanding of local context. And this, my main source was a study by Agumasi where they looked specifically about challenges in East Africa. Lack of understanding of local contexts and the understanding that one size fits all. Then there is a low political priority, which sometimes translates into budgetary priority. Of course, for Uganda, we are going to add deals between the ministries and then constraints in resourceation. You know, you have a very good idea, you even manage to come up with an innovation, but the way the innovation is structured, it cannot be used. So it sits as a white elephant. There are very many examples of that. Then poor stakeholder engagement and ownership. I think this is a very, very big obstacle where we even know, sometimes we even know the stakeholders, but one, we don't want to engage them or we don't think it's priority. I've sat in meetings where people are negotiating budgets, budget cuts, and the first thing that gets cut is community engagement, because it's not considered but it's extremely important. Otherwise, who are you doing the research for? Then poor accountability mechanisms can also be a challenge in uptake because you don't know if the research is actually being utilized or not. Lack of appropriate communication and dissemination platforms, I put that in red because we are going to talk about it. Wrong research questions being asked, therefore scratching where no one is itching. Insufficient involvement of policymakers, communities, and other stakeholders. We've talked about that. Irrelevant research results. You can have beautiful results, but if they're not answering a question embedded in the community you are trying to affect or the public you are trying to influence, it is irrelevant. And therefore, there's not going to be uptake because, again, you are scratching where no one is itching. Insufficient investment in research, lack of resources and expertise to implement research findings, limited funding, infrastructure, and skilled personnel, lack of systems to track and evaluate, which is the same as accountability mechanisms, and limited access to effective channels for sharing research findings. So what's the role of communication in all of this? I'll talk first about strategy. I think a lot of things hinge on strategy. Effective research uptake can be facilitated by a comprehensive multimedia communication strategy that utilizes various platforms and approaches to reach audiences. A lot of times when we talk about research, we talk about uptake. But I was pleasantly surprised to find that it is not only limited to things being taken up at the policy level. Beyond research uptake, it's crucial to consider side take, which is among peers. Are your peers buying into the evidence that you are producing and sharing with them, or the thinking that you are advancing? But also, we need to consider downtake, which has to do with the public and the community. Many funders in low and middle income countries are increasingly interested in measuring the adoption of research results at different levels, including at the level of policymakers, practitioners, and communities. They want to know where their money is going. They are not now satisfied to just sit back and receive budgets and receipts. They want to know where the money is going. In fact, they are visiting, they are living in the communities, they are hearing from the end user. So we need to be awake to this. And a communication strategy helps you to also demonstrate that you have made an effort to reach out to these stakeholders. The media plays a vital role in connecting researchers with end users of research, facilitating uptake, side take, and downtake. Utilizing multiple platforms is essential for effective communication. Through multimedia communication, power barriers are broken and knowledge is democratized. One of the sins of academia is arrogance, thinking we know it all. Sometimes our research puffs us up. If you publish a paper and you get many tweets, many likes, many retweets, voted replies, shares, etc., you think you're it. You think the world rotates around you, basically. And then you forget what your real mission is. Researchers should approach research uptake with a degree of humility, recognizing that our research informs rather than instructs policy and practice. It informs. People have a right to accept or refuse it. Policymakers and practitioners are not obliged to follow our evidence. And that should keep us humble. It's also important to avoid monopolizing research uptake or claiming credit for all policy changes. While researchers and funders should follow up on their research, it's not always easy to draw a direct line between research and its impact. You can't really say that this community changed its behavior because of my paper, because there are so many other factors at play. So that also should keep us humble, but should also remind us that it's not about us. It's not about your solo contribution. It's really about the change that you want eventually. The media can help researchers trace the contribution of their research, however modest, and facilitate both positive and negative feedback. I think when Alex speaks, he'll tell us how you can actually measure if you are having any impact at all, or if you are reaching anybody at all at the very minimum. We also need to remember that negative feedback is a form of uptake. If you introduce something to a group of people and they reject it, that is also uptake. Negative feedback is not always a bad thing. Because if they reject it, it means they are choosing something else. And maybe that something else works better than what you were proposing. Good research uptake occurs when good ideas, practices, and people, good ideas, practices, and people are integrated into a replicable and observable decision-making process, leading to tangible outcomes. In other words, we shouldn't be satisfied with parachute efforts. We should be thinking of a long-term thing. What I have done contributed to something that lasts more than the 6 months of this research or the 3 months of dissemination? Has it linked up into indigenous knowledge, into things people already had going? And will a future person be able to connect to this so that this community does not go back to zero the moment we exit? As I conclude, I would like to say that communication tools can be powerful in aiding uptake, but researchers should not value the sophistication of these communication tools more than the quality of their research. It's important that what you are pushing is high quality. It's extremely important, much more important actually than the platforms you're using or how dramatic you are. You know, these days we can make our presentations that are really dazzling, but it doesn't matter if there's no quality in there. Strategic communication is essential for ensuring that research findings reach the right audiences and have a meaningful impact. And it's important to remember that research is not straightforward process, and that multiple. I thank you very much. And
Thanks so much, Professor Monica, for that very powerful presentation. I have had new concepts I've never heard about, such as research, side tech, down tech, and things like that. I think we can move to the next presenter, Mr. Alex Taremwa. Then we can go to the discussion later. Mr. Taremwa, you have about 30 minutes or so.
All right, I think I can make do with that. Good morning, everyone. It's a pleasure to join you. I feel at home and also feel embarrassed for myself that I'm not a member of NEMRA. I was telling Prof. Monica that I wish I knew that this community was present even before, because the work that we do is quite important if it's within a community. And I promised her that by the time this week is over, I will have completed my onboarding and membership process. I also like to send shout outs to my grandfather. I don't need to. Now you owe me for not introducing me to this organization, because as I can see, you've been a member for some time now. I even saw one of your testimonials on the website. So when we meet, where we usually meet, we will need to discuss why I was not brought into this fold earlier on. I would also like to send greetings to Robbie, who is also a mentor of mine from the work I do on the side as the co-founder of a climate change startup called Last of Africa. My other colleague is actually on call, Mr. Edward Nimsim. I've seen him online. So my work is pretty simple. It's basically to walk us through the process of how to create interesting, engaging, but also communicating research inputs in ways that people can consume and engage with. I have a not so long presentation, and I would like for us to dig into it right now. I'm just going to share my screen, and then we'll be on our way. Just a quick introduction of who I am. My name is Alex Taremwa. Currently, I work at the Graduate School of Media and Communications at the Aga Khan University. The school is in Nairobi, but we have quite significant representation in Uganda. We've graduated about 35 or so students. We only have master's programs at the moment, but we are also promoting other programs when the school opens officially in Kampala. But I'm also affiliated to Uganda Christian University, where Professor Monica and I met many years ago. She's more of a mentor. She's my mother. Yeah, she's turned me into an academic, yet I thought I would spend entirely most of my life in the media industry. And I thank her for that. So today I wanted to see how we can leverage multimedia to disseminate research. In 2019, I was attending the East African Communication Association's conference in Nairobi as a student. And I told that room of researchers, just as this, that I find your communities as echo chambers. You like to speak to yourselves in your very hard languages, in your peer-reviewed journals, and you assume that somehow the industry or the policy are finding utility in your work. Yet I don't find most of your research very accessible. Accessible not because that they are behind paywalls on journals and other databases, but accessible because the language within which you communicate this research is not palatable to the audience that you are trying to reach. So it creates the gap or the divide that a professor has ably demonstrated in her presentation. So within the 30 minutes or so, we're going to try and see how to use the new technology tools to try and break down those hard-hitting, very important resources that you create in your research, so they don't just stop at gathering dust on shelves in your libraries and schools, but they also reach the industry and create the kind of impact that you've spent this 1 or 2 years trying to create. I had a simple game here, and it's not quite a game per se, but I wanted us to go to this website. It's called menti.com. I had a question there asking how you have been disseminating your research, so that I know what tools you've been using, so I don't get to repeat those that you already know. Let me just throw that in the chat, and then we can have a conversation there on